Welcome back, guys. Again, this is Dr. Severin. So in this unit, we're going to start going over some of the more common medications that you'll encounter in managing patients with pulmonary issues or respiratory issues. So the first family of meds we'll talk about are bronchodilators. So we've got three general types. Our adrenergic agonists or sympathomimetics, our cholinergic antagonists or anticholinergics, and their methylxanthines. We'll get kind of into those in a bit. So epinephrine, which is medication used often in emergencies, is a non-specific beta agonist. It's basically adrenaline or an epinephrine head holding the pen. That's why it's called an EpiPen. You might see this often used with kids that have risk for anaphylaxis. Basically, anaphylaxis is when we have a serious constriction and swelling in the airways, often due to a allergic response. My younger brother, growing up, had or still does has a fatal peanut allergy, so he always carried his EpiPen. Because what an EpiPen does, it causes, when we inject it into the muscle, so it's usually an intramuscular injection, a little needle here. It sends a rapid delivery of epinephrine, which goes to every tissue in the body. And again, our sympathetic nervous system, again, think epinephrine or epinephrine, causes dilation of the airways. So the epinephrine can be very effective in those emergent situations when we have anaphylaxis, when we need to open up the airways immediately, or that person's going to have serious problems and potentially dying. So again, it's a non-specific beta agonist. It goes everywhere. It's an emergency medication. You can also see epinephrine given through an IV medication in patients maybe with sepsis, respiratory failure. Pardon me there. You can see it given for again other emergent situations, and usually often given through an IV. It's a short time to effect, like 3 to 5 minutes until you start seeing it kick in, maybe even earlier. And the peak effect really hits about 20 minutes. It's really important that kids with allergies carry these around, always have them on them, get them recalibrated. They do expire, which I think some people forget. So it's always good to make sure that they have those with them. And again, remembering that this is a medication that has effects on every tissue. It's a non-specific beta agonist. You're basically giving someone a shot of adrenaline. So next we'll get into bronchodilators or adrenergic agonists. These aren't the same as epinephrine. These aren't like we're giving someone epinephrine or norepinephrine. They're mimetics. They are things that kind of mimic the effects of the sympathetic nervous system. So by targeting the beta-2 agonists, or beta-2 cells, or beta-2 receptors rather, in our sympathetic nervous system, we can facilitate bronchodilation. So we have two general types of these beta-2 agonists. So again, they are attaching to the beta-2 receptors in the sympathetic nervous system. Our beta-2s in our lungs cause dilation. We have a short-acting variety and a long-acting variety, right? So our short-acting variety we call SABAs, which are your rescue inhalers. You've probably seen one of them before, or it's often called a Ventolin inhaler. The common drug name for that is albuterol, the generic name. Again, very short-acting, 5 to 15 minutes before it gets to really peak effects. Doesn't last super long, 3 to 6 hours. Usually patients with asthma carry this around with them in case they have issues breathing, or in patients with that exercise-induced asthma, they may take it a few minutes, maybe 15 to 30 minutes prior to exercise to get those airways open so they don't have any issues while they're exercising. So every patient has a different medication schedule depending on their condition. And then we have LABAs, which are long-acting beta agonists. So they act on the same receptors, but they just have a longer-lasting effect. One of the more common ones you might see out there is salmeterol or Ceravent. Salmeterol, again, is the generic name. Ceravent would be the brand name. Similar thing, pretty short time to effect, but the advantage of a LABA, it lasts for 12 hours. So someone who's got asthma, chronic issue, it might not be a bad idea to keep those airways constantly kind of open and dilated and suppress those mast cells. Because again, we talked about what the sympathetic nervous system does to the airways. And they don't have to take that multiple times per day. They take it once in the morning, usually once in the evening. And I was on this as a kid. I would take it every morning and then take it when I got home from school. The side effects from bronchodilators, like I mentioned, inhalers typically have minimal side effects. That's because, again, we're giving much smaller dosages with every breath because we're getting directly to the tissue. We don't have to pass through the liver or the liver, the small intestines before we get to the bloodstream and then to the tissue. We get right to the tissue. Even though a good bit gets swallowed and doesn't make it to the lungs, it still goes right to the lungs because we're breathing it in, or a good bit of it. So the side effects are just what you would expect, anything that may spill over and stimulate the sympathetic nervous system likewise. So tachycardia, tremors a little bit, you might get a little shakiness, a little bit nervousness, a little restlessness. Again, you're thinking that you're basically giving someone the same effects of adrenaline, even though it's not adrenaline, it acts on the same receptors and causes similar effects. But it's not adrenaline, it's a little bit different. Again, sympathomimetic. Now, the effects can be variable to each individual. Now, there are some theories out there that oral, right, or liquid Ventolin or albuterol can be used as a fat loss drug. Because the thought was that you can use the sympathetic nervous system to kind of simulate, fat burning. Evidence for that's kind of inconclusive, but as a little bit of an insight for anyone involved or interested in sports, one of the most common conditions you see in Olympic runners is exercise-induced asthma. Now, the thought process was, well, that's kind of weird. Like, why do we have the super elite runners all have asthma? The theory was that they were taking or getting a false diagnosis so they could use inhalers for the effects on the lungs and as well as maybe to facilitate fat burning while they're exercising. Needless to say, it is something that is often checked. So if people are taking Ventolin, especially oral Ventolin, that's usually a bit of a red flag. Because even if you're an athlete with exercise-induced asthma, it should still probably be an inhaler. So just something to bear in mind that, and then the dosages, for that you'll see in the blood, if that's really high, it's probably not coming from an inhaler. It's probably coming from an oral medication, and there's really no reason for an adult to take an oral or liquid Ventolin. Liquid Ventolin or albuterol can also be used for kids. I took liquid Ventolin when I was a younger child, but again, if you see that being used in an athlete, that should be a little suspicious. So we also have cholinergic antagonists again. These kind of block those muscarinic receptors and cholinergic receptors in the bronchioles. This is a drug of choice for COPD. They have really great kind of long-term effects. They're not as well used or as effective for asthma. You typically have less side effects than you do with a beta adrenergic agonist as you do with an antimuscarine. The most common you'll see is ipratropium or Atrovent, which is used 3 to 4 times per day, and then we have tiotropium or Spiriva, which you can use 1 per day. So very, very very long-acting medication you don't have to use super often per day, just once per day. So I also like how most medications for pulmonary respiratory issues use some sort of vent or Spiriva, something like similar to air. Kind of very, very interesting to me. Then we have combivan. So combivan combines the benefits of a LAMA and a SABA. So it's almost analogous to that Tylenol with codeine, right? So you get a short-acting effect of acetaminophen and a long-acting effect of codeine. Same kind of concept here. Got a short-acting effect of albuterol, and then a long-acting effect of an antimuscarine, ipratropium. So you get the double effect. You have a short-acting dilator and then a long-acting dilator, which has less effects. You may see patients use this, combivan. And then another medication you might see patients use are methylxanthines, or maybe not necessarily use, but you may see reference for pulmonary medications. So methylxanthines or xanthine derivatives, these are medications that, again, are also sympathomimetics. that can have effects on the airways. Theophylline, theobromine, which we see in chocolate, and then caffeine. Yes, caffeine, our famous and our favorite Starbucks coffee, does have can have some pretty potent effects on the lungs. That's why caffeine is for many, for its attention boosting effects, as well as maybe fat burning or maybe caloric restriction effects, and mood altering effects. It is restricted for athletic participation, about 2 cups, but it also dilates your airways. So if you sometimes if you have a little bit of congestion, I actually take a cup of coffee, and it feels a little bit better. I actually remember an old ER or emergency doctor told me that if you're ever stranded and you don't have access to your EpiPen, I actually had this happen to me. Take a couple shots of black coffee or espresso without sugar or cream, until you can get to an emergency room to get an EpiPen. So I just think bear that in mind. They act by inhibiting phosphodiesterase enzyme, increasing CAP, and they block in terms of the mood altering effects. Caffeine specifically blocks adenosine receptors. So that's what we think kind of facilitates the sleepiness and fatigue and the focusing effects or attention focusing effects of caffeine. So you can see bronchodilators given oral, obviously is probably the most common one, drinking coffee. You can also see injections. Obviously the side effects, we've all had caffeine before. They're all very similar to each other. Irritability, restlessness. Key thing to bear in mind, theophylline can cause arrhythmias and seizures. So people, that's often used with caution. So we'll end here talking about our bronchodilators, and the next we'll get into some of our anti-inflammatory medications.